Hi, my name is Akhil Sood, reporting from now at ACR 22. Today I'd like to discuss abstract 1609, which looks at the impact of comorbidities in patients with ankylosing spondylitis and its association with functional status and disease activity. Comorbidities are more common in patients with inflammatory arthritis, including ankylosing spondylitis. It is suspected that the presence and combination of certain comorbid conditions can influence patient outcomes. And abstract 1609 specifically looks at this area. Using the SOAS registry, they identified a cohort of patients with ankylosing spondylitis. Using clustering methods, they identified clusters of patients with AS defined by the presence of certain comorbid conditions. And in this study, they identified 5 unique clusters defined by these conditions, including depression, hypertension, and uveitis. And the cluster defined by the presence of depression was found to have higher disease activity and worse functional status compared to the group with no comorbidities. And these findings are really important. They come in light of the recent recommendations from ASAS-EULAR, which states that the absence of response to treatment should prompt reevaluation of the diagnosis and consideration of the presence of comorbidities. So next time you have a patient with AS with difficult to control activity, it is important to consider optimization of the comorbidities as well as controlling the underlying inflammation.